So good afternoon, one and all. My paper is on the topic Visual Impairment Assessment Efficacy with Electroretinogram in Children on Vigabatrin, a descriptive study. So Vigabatrin is an anti-epileptic drug which is indicated only in refractory seizures in children. But the major ocular adverse effect is retinal toxicity, which is manifested as visual field loss and is estimated to have a prevalence of about 30 to 40%. But for most children on Vigabatrin, a normal vision or field assessment is not possible due to their young age or neurodevelopmental delay. So there is a need for an objective test for the detection of the toxicity. So Vigabatrin is actually acting at the synapses by inhibiting the enzyme GABA transaminase and thereby increasing the concentration of gamma aminobutyric acid, which is an inhibitory neurotransmitter and producing anti-epileptic effect. So the aim of the study is to analyze the efficacy of assessing retinal toxicity of Vigabatrin using ERG in a group of children with epileptic disorders. So this was a retrospective study at a tertiary eye care institute, and patients on Vigabatrin presented to our OPD in a time period of 2016 to 23 were included, and we collected the data from the electronic medical records, which included detailed clinical history, functional vision assessment, ocular alignment and movement, cycloplegic refraction, dilated fundus examination, and electroretinograms on baseline visit and at 3 monthly follow-up visits. So the normal vision or visual field assessment is actually not possible in our subjects. So we performed a functional vision assessment. But it is not reliable in detecting the toxicity because it depends upon the general status and cooperation of the patient. So baseline and follow-up ERGs for these patients were done under oral sedation with the syrup chloral hydrate, which is a weight-dependent dosage according to the pediatric prescription and according to the ISCV guidelines in red depot scan with Gansfield illumination and detailed thread electrodes. Visually worked potentials were also recorded only in the indicated cases. So coming to the results, out of the total 20 study subjects, there were 11 boys and 9 girls with a mean age of 5.4 years. The major study population was below the age of 3 years. The mean duration of the therapy in the study population was 41 months, ranging from 1 month to 9 years. Only 2 study subjects had a longer duration of Vigabatrin, more than 5 years. The major indication of the drug was West syndrome or infantile spasm, followed by hypoxic ischemic encephalopathy. In infantile spasm, majority were idiopathic, followed by tuberous sclerosis. So this is the distribution of the baseline functional vision assessment, and we can see that about 70% of the cases had poor functional vision at presentation, which indicate a need for an objective assessment. Moreover, 2 cases developed who had Vigabatrin toxicity on follow-up actually showed improvement in functional vision assessment, which is actually contradicting to the effect it produced. So this improvement can be possibly due to better seizure control rather than direct effect on vision. So this is a table which shows the mean B wave amplitude and the oscillatory potential reduction of the values of the light adapted 3.0 flicker 30 Hz. So this is a serial ERG of a patient who had Vigabatrin toxicity, and the top trace shows the baseline ERG and the subsequent ERGs on follow-up. So we can see the gross reduction in the B wave amplitude from this picture. So this is a linear plot which shows the percentage reduction of the B wave amplitude from baseline through the follow-up visits in all the 7 patients who had developed toxicity. This is also a linear plot showing the reduction in the oscillatory potentials in the patients who developed Vigabatrin toxicity. So in the VEPs recorded in case of suspected optic nerve dysfunction and pallor, the 7 case subjects on dilated fundus examination showed optic nerve pallor, and we recorded abnormal waveforms only in 3 of them, and there was no significant correlation between the VEP and the Vigabatrin-induced retinal toxicity. So coming to the discussion, the prevalence of Vigabatrin-induced retinal toxicity from our study was 35%, but it is slightly higher than Westall et al., which the study was the largest cohort of children with infantile spasm investigated for Vigabatrin toxicity, but it is comparable to Maguire et al., which is a systematic review. In our study, the percentage reduction in B wave amplitude ranged from 55 to 83%, which was in the range of 37 to 52% in Westall et al., and the average reduction was approximately 69% in our study. The reduction in the amplitude of light adapted 30 Hz flicker cone electrogram ERG is associated with vigabatrin attributed to field loss. So the 30 Hz flicker ERG actually provides an assessment of vigabatrin retinal damage in infants. The oscillatory potential reduction with the vigabatrin treatment was also observed in our study. So there have been studies which showed male prediction, but this was not seen in our study. So coming to the conclusion, vigabatrin has been known to cause retinal toxicity in long-term usage. Hence, assessment in pre-verbal population with a reliable investigative modality is of utmost importance. Our analysis actually indicate ERG as an effective tool for monitoring vigabatrin-induced retinal damage in pre-verbal children. These are my references. Thank you.
Good presentation and good study. Did you do VEP also or only ERG?
VEP only in indicated cases like when we do a dilated fundus examination on those patients who showed optic disc pallor.
Okay. So otherwise, where do you expect the damage in vigabatrin?
Vigabatrin actually causes damages at the level of RP photoreceptors and bipolar cells. So that is the expected theory. So exact mechanism of damage is not still found out, but that is expected.
Do you have studies in adults to know where the what kind of visual field loss is there?
Yes. It was actually the toxicity of vigabatrin has actually found in a case series of 3 patients who actually showed intense visual field loss after a long duration of vigabatrin therapy, and that is how this visual field loss with vigabatrin has come to.
Okay.